And I'll just check that you can see that screen.
Yeah, very visible, very clear.
Great, thank you. So thank you again for giving me the opportunity. I am looking forward to these discussions, and I completely agree with you. One fatality is one fatality too many. And these events are happening regardless of which border. So I'm going to talk about leading approaches to preventing fatalities in the workplace. And I'll talk through some of the experiences and research and education work that we do around the globe, and happy to have the discussion and looking forward to the discussion towards the end. So I did introduce myself a couple of minutes ago, but for those that came late, my name is Maureen Hassall. I'm the Professor and Director of the Sustainable Minerals Institute Minerals Industry Safety and Health Centre. I'm a researcher, a teacher and a consultant and I cover the areas of risk, system safety and human factors across the high hazard industries. As I said, I'm really passionate about fatality prevention, and I think that will come through improving the design and management of work so it is safer, healthier and more rewarding for all. And that includes a diversity of researchers. I've spent over 30 years across a range of industries, including mining, metals and minerals processing, oil and gas, manufacturing, chemicals, and other high hazard sectors, predominantly in Australia, Canada, and New Zealand. I haven't done much in Africa, but I have collaborators in Ghana. So that's another reason I'm really excited to have this call, to learn more about what happens in Uganda and Tanzania and Kenya. As I said, my background crosses engineering, psychology, and human factors. So that's a little bit about me. In getting into the presentation, usually where I start is what does the data say in terms of workplace fatalities? Well, firstly, we know that they're still occurring across the globe, and they're still occurring across a range of industries, and they're occurring at an unacceptably high rate. This is some data on the slide in the top left, so shows the ICMM, the International Council for Mining and Minerals data from 2012 to 2023. On the right-hand side shows some oil and gas data from 1937 through to 2014. And down the bottom, it shows some data from Norway, with the light grey being the construction industry. When I look at this data, as I said, we're not any way I cut data, whether it's across regions or across industries, we're still finding these fatalities are happening. We're finding that the fatalities are still at a high rate, and over the last probably decade, they're pretty much plateaued. So we need to do more in this space. When you're looking at the data on the screen, you see some blips on the oil and gas and mining data, and in the construction data on the bottom of the screen, it sort of goes up and down. So one thing that as a researcher I do is I try and look behind the data to see what we can learn, see what insights we can get from the data in order to help point us in the right direction to prevent future fatalities. One thing that the data is telling us is that the traditional thought that there's only one type of safety, and that that safety is occurs across all operations, and the severity of an actual outcome is to do with the probability of that safety, either from an unsafe act resulting in a death, a serious incident, a minor accident, or a near miss. But what the data is actually showing us is that there are different types of safety. And those different types of safety have different mechanisms at play. We have the minor, non-fatal injuries and illness events that are happening. They're the slips, trips, the scratches, the cuts, the abrasions. We also have task-related single and double fatality events that occur. Things like falling from heights, being caught in a confined space. Vehicle incidents can fall into that category. And then we have a third type of safety, which is when we have a catastrophic failure of a system. And that's when we have major disasters that happen, whether they are tailings dam failures, major infrastructure collapses. In the oil and gas industry, you can have massive fire and explosions. In the mining industry, you can have underground cave-ins. They're system-related multiple fatality catastrophes. To explain that in a little bit of a visual way, the different types of safety can be categorized and have traditionally been categorized into personal safety, into process safety, into system safety engineering, and in the mining industry, in some jurisdictions, we have a term called principal hazard management. Personal safety is where we have people exposed to risks related to the task that they're doing. And the picture there is showing someone falling from heights. If we're tackling this type of safety, we're trying to prevent the unsafe exposures or the loss of control of work. In process safety, this is when we have hazardous substances or energy sources like high pressure and high temperatures. And what we're trying to do is prevent the loss of containment of those. And the industries that are more known to be specialists in process safety are the nuclear industry, the petrochemical industries, the food industries, and some minerals and metal smelting and refining industries. The system safety engineering is where we have a loss of control or an unsafe operation of hazardous machinery. And the picture there shows some autonomous trucks. But there are industries that specialize and run off this system safety engineering, and that's the aviation industry, the rail industry, the space industry, robotics industries, and manufacturing, because that's highly robotic driven in many jurisdictions. And then the last category is the principal hazard management category, where we're trying to prevent the loss of major mining hazards, such as falls of ground, tailings, disasters, inrush events, or shafts and winding catastrophes. So the first thing that we learn if we want to have a leading approach to safety is we need to understand which types of safety we're focusing on, and then how do we make sure that we're capturing all the types of safety that are relevant to our operating context. Because history has taught us time and time again, if we're only focusing on personal safety, then we'll miss some of these other significant disaster type safety events. And if we're focusing on the big disasters, types of events, then we'll miss some of the really important personal safety type events. So for operations, we know that we have to understand that safety is different. There are different types of safety, and we have to manage the safety that's relevant for our context. The other thing that the data is telling us is that we're really not finding new ways of killing people. The data shown on the slide is actually Australian data, but this has been done across a number of different data sets where we break the fatality type incidents into what is the type of event that caused the fatality. And on the slide, we can see that the purple events are vehicle-related incidents. The yellow events are the working at heights or falling from heights type events. The bluey green colour is the interaction with energized plant and equipment where people die if they're hit or they're caught in that equipment. The orange is the contact with electricity and the grey is the other. So we find that across the globe when we're looking at this type of data, vehicle accidents is often a major cause of worker deaths if it's counted in workplace deaths. And then falling from heights and the interaction with energized plant and equipment are the others. These are the fatalities that continue to occur on a regular basis across industries and across the globe. These fatality data is the baseline data that we saw in the previous statistics. And then when you get I'll just flick back a couple of slides. When you get the bleeps, like in 2019 in the mining industry and across the oil and gas industry, that's when we have the major disasters that take out many people. So the baseline is the vehicles, the fall from heights, the energized equipment, and the peaks when we get them are related to the catastrophic system-related multiple fatality events. So we need, if we're going to target zero fatalities, we need to target the full range of safety that impacts our operations. When we look into the events, be them catastrophic disasters or fatality events, we do meta-analysis across databases. We find that most incidents are from known risks. We're not finding new ways to kill people, as I said previously. So these incidents are occurring because we're actually failing to implement the controls that are well known for managing the risks. We either don't implement them or we don't maintain them. So they become ineffective, unenforced, or absent across the lifetime of an asset. So one of the leading approaches, or many of the leading approaches to fatality prevention includes understanding the risk and then controlling the risk and being very deliberate in that. So in understanding the risk, we want to draw on the evidence to help us understand what risks exist, understand the significance of that risk in terms of consequence, and then evaluating that risk in terms of whether it's acceptable or it needs a rigorous type of risk control. Now, all fatality-related events, in my opinion, should get the rigorous related risk control. And that involves rigorously selecting the controls analysing the controls needed to manage the risk to make sure you've got adequate number of effective controls, and then actually implementing management plans to ensure those controls are implemented, monitored, and maintained over time so they continue to protect workers and keep them safe. So the leading approaches that are used to deliver improved fatality prevention in safety include evidence-based approaches and risk management-based approaches. When I'm talking evidence-based approaches, what I'm referring to is actually doing deliberate reviews of literature, analysing past events to make sure we're learning from past events and we're capturing those lessons learned, and also engaging with stakeholders that understand our context and are able to take the literature information from the literature review and the evidence analysis and make sure that the application of that in our context is correct. In terms of the literature review, there's a range of literature that exists. There's literature in the research realm, and there's literature in government. Information in many jurisdictions, the government and the regulators provide guidance material that is quite useful. And so does industry organisations across the globe provide information that is quite useful. In terms of event analysis, there's growing databases of events that can be referenced to understand what events are happening and why they are happening and what are the recommendations from the incident analysis to prevent reoccurrence of these events. As I said, many of these events are reoccurring events. They've been fully investigated in the past, and those investigations have come up with some recommendations. In terms of stakeholder input, for these fatality type events, the stakeholders need to include the workforce and need to include subject matter experts who understand the risk, who understand the controls, and are able to provide good guidance on how that risk should be managed and controlled. In terms of risk-based management of safety, we defer to ISO 31000, which is the international standard for risk management. That standard has a recommended process which is shown in the diagram on the right. It starts with establishing the context, then undertaking a risk assessment where you identify the risk, analyse the risk, and evaluate the risks. Those risks that aren't acceptable, then you put through risk treatment processes. In the process of establishing the context, doing the risk assessment and the risk treatment work, you should be communicating and consultating, monitoring and reviewing and recording and reporting. And this is to capture the continuous improvement type activities where you plan the work, you do the work, the risk management work, you review the work, and then you improve actions, you implement actions that come out of the review to improve performance. When we look at these activities, doing the literature review, the event analysis, the stakeholder input, for establishing context, for doing the risk assessment, and for determining risk treatment activities, that's a lot of work. There's a lot of information available, volumes and volumes and volumes of information available in text, in numerical, and in image data. And it is really difficult to process. One of the areas where leading organizations are pursuing at the moment is using AI analysis to process that volumes of data. So we can have intelligence-based analysis done on the data to produce a synopsis that then can be reviewed by stakeholders. So the analysis of the data tends to be using large language models on the guidance material and on the literature, and a combination of image and text-based AI analysis on the events. So this is information, this is leading practice that actually can help and it can hinder performance. When we do research to work out the validity of using large language models like ChatGPT or Copilot, or even in-house developed large language models in Australia, the Australian Institute of Health and Safety have their own internal model that points to their body of knowledge. These models can give insights, but they can also produce what we call hallucinations. AI cannot tell the difference between fact and fiction. It does pattern matching. It cannot apply morals or ethics to the data to judge which should and shouldn't get more priorities. The net result of that is it does provide some good insights, but it also provides some fictional information that is not correct. So if you're using AI, it is really important that whatever output is critiqued and scrutinized by subject matter experts, which include the local workforce, those that are involved in managing the risk. When using the International Standard of Risk Management approach, one thing I find with the diagram presented in that standard is that it puts a lot of emphasis on risk assessment, but very little emphasis in comparison on risk treatment. And I think this is one of the reasons why we have problems around the implementation and the maintenance of controls for fatality risks. It's because the standard is not directing us to be as rigorous with risk treatment as we need to be with risk assessment. So I actually teach and present an extended version of ISO 31000 framework, and that's shown in the center of the slide, where we do our risk assessment to work out what are the risks that we need to manage. And then our risk treatment activities should involve control identification, control analysis to make sure that we've got the right controls for addressing the risks, the right number of controls, and the controls addressing all the threats and consequences that matter. And then we actually identify how we're going to implement, monitor, and maintain those controls so they are sustainable and reliable and effective at addressing the risks. So leading practices takes the ISO process and they first establish the scope by doing something like a scope table, which states the purpose of the activity. and the scope of the activity, what's included and what's excluded. The risk assessment process is usually done by some sort of hazard analysis or hazard identification process. That can be called a PHA, it can be called a broad brush risk assessment, it can be called a risk register process. HAZOP and FMECA, failure modes effects analysis, are often used. And these should be accompanied by a what if analysis, just to make sure that we're capturing possible knock-on events and worst case scenarios. The risk analysis process is usually done to determine, firstly, what is the maximum consequence. And some use matrix to guide people on how to determine consequence. Is it just health and safety? Is it health, safety, and environment? Does it include community? Does it include operational losses as well? All those things are usually documented on a risk matrix, and I'll show you an example soon. And other more sophisticated operations use QRA, or quantitative risk analysis techniques, that can involve modelling fire and explosion, toxic dispersions, and those kind of things. The evaluation part of the risk assessment should involve determining what type of safety event is it. Is it a catastrophic event? Is it a fatal event? Is it an injury or illness? And that goes back to the initial triangle that I showed you. Then for risk treatment, often the risk treatment is done using the risk assessment tool if it's less than a fatality. So most risk assessment tools, and I'll show you one on the next slide, has columns for controls. But if it's a fatal risk, I argue that we need to do a little more rigor than just using the risk assessment tool. I think, and leading practice has demonstrated, we should do a quality bow tie analysis complemented with some sort of assessment of whether we've got the risk to as low as reasonably practical. And that can be done with an inventory analysis, ETA, a LOPA, a layer of protection analysis, or again with a QRA type approach. Once we've got the layers of controls on our bow tie that gives us the required risk reduction, we can then do management planning to make sure those controls are implemented, monitored, and maintained. And this can be done following the ICMM critical control management approach, which is available. If you Google that online, you'll see that there's some free guidelines available on the internet. And then after risk treatment, again, we have the blue areas of the framework, the communication and consultation, the monitoring and review, and the recording and reporting. And these should be integrated with our safety management system and our normal operating systems of our business. So I mentioned the risk assessment tool. Often when you're looking at, be it preliminary hazard analysis or hazards or HAZOPs, you see a spreadsheet table tool like this, where we have some columns up front that talk about the hazard and the event scenario. We have some columns that talk about the impact that scenario might have in terms of consequences. And then we might do a risk rank and determine what controls we need. Now, if the risk is simple and the controls are simple, then these work fine. But for our fatality risks, there's a number of issues with them when I have reviewed the ones that I've seen across the globe. One, they usually have a poor quality list of what are the unwanted events. What are the events that can happen if we lose control or lose containment of the hazardous chemical or the hazardous energy source or the hazardous machine? So there's not a lot of discipline around those unwanted events. There's either too many or too few of them. And then when we move on to look at what controls are actually listed in this table, we find that there is often too many or too few controls. There is a range of things that are listed as controls. The controls might be all preventing or just mitigating the unwanted event, but there's no real matching of controls to causes of the unwanted event or consequences to make sure that they're all covered. There's limited review or critique of the controls. There's no identification of which controls are actually critical controls that prevent fatalities. And these types of worksheets tend to actually lack assigning accountability and management for the controls that are critical for preventing these events. So we need a better way to identify and manage the critical controls if we're going to prevent fatalities. So as I said, what we do and what is leading practice is that we look at the risk treatment part of the ISO 31000 process, and we follow in that risk treatment part the ICMM critical control management guidance material, which it's shown on the right hand side in really small, this really small circle. So blowing this circle up, what does it mean? What does it show? Well, it shows we need to plan if we're going to use the critical control management approach. It starts with the identification of what are the material unwanted events. So material unwanted events in most organizational language are the events that actually could result in fatalities to workers or significant and permanent harm to workers. So things like lung disease can be a material unwanted event. We then identify the controls required to manage that event using bow tie analysis. We select the critical controls. We define the performance and reporting requirements of those critical controls because we manage what we measure. We assign accountability for those critical controls to make sure that they're actually implemented, monitored and maintained. The implementation is step 7, monitoring them and maintaining them and reporting on them is step 8. And then step 9 is responding to any inadequate critical control performance. So some organisations have been pursuing the critical control approach since the publication of the document, which was 2015. And here's some of their responses. So in 2022-2023 business reporting period, Rio Tinto reported in their annual report that they were 4 years fatality free and that critical risk management remains their primary fatality elimination tool by helping ensure that the critical controls are in place and working where there is a fatality risk. So prior to the implementation of CRM, Rio Tinto were getting a couple of fatalities, 1 to 2 each year. It's a major international mining organisation. So they actually went 5 years before they saw a fatality, and that was a major significant step change improvement for them. Newmont, also another mining fatality, and they reported in their sustainability report at the same period that they had achieved 4 years fatality-free by maintaining a clear focus on mitigating risks that could lead to a fatality through their fatality management program, which required the identification of critical controls and the assurance that they must be in place before work starts. So organisations who have invested in this approach have seen significant improvements or significant reductions in their fatality rates. These are just two that have reported it. And there are a number of others that have also experienced it, but they just haven't released that information in the public reports. So I'll talk through in a little more detail what this approach is. So firstly, we plan the process. That's just making sure that you're organised when you're going to undertake critical control management, because it really is a change for the organisation that focuses the organisations on the things that prevent fatalities. The planning process involves covering the objectives and making sure you've got criteria or definitions for what is and what isn't going to be a material unwanted event. As I said, most people settle on fatality related events being material unwanted events. Material in this sense just means significant. Make sure there's a clear understanding of the roles and responsibilities and the provision of training and competencies prior to starting it, because if people don't know what it's about or how to do it, then it will run into some roadblocks. Providing the method and format to use for controls, critical controls, verification and reporting, and the guidance material have some examples, but these have been refined over the last 10 years. And if you're interested in that information, I'm happy to share beyond what's in this presentation. Determining the tracking, reporting and response requirements at a system level, as well as a material unwanted event level, as well as a controlled level. And then making sure that interlinkages between the critical control management activities and the other organisational activities is clear. So this is integrated within the organisation, this approach, and not a bolt-on. So one thing that we need to do with regards to consequence, when we're determining our material unwanted event, we need to understand what are the consequences, because those events are determined by the severity of consequence, whether it's a fatality or multiple fatality. Now, one of the things we've found is when people are making that assessment, they're making it on most likely, maximum possible, maximum reasonable, or some other criteria. And organisations need to be very clear on which criteria that they're going to use for determining material unwanted events. This example on the slide shows the COVID case, where for most it was asymptomatic or mild cold and flu. For some, it was hospitalisation, and for a smaller proportion, it was death. So if you're going to do determine material unwanted event based on consequence, then leading practice does maximum possible, because that makes sure you've got the controls in place to address the maximum possible. If you decide after identifying those controls that it's cost prohibitive or unreasonable, you can then make decisions of how to adjust. But unless you identify material unwanted events as the maximum possible, then you won't know what controls you should need to be in place, and you won't know what are your most severe risks. This is an example of a matrix, and often organisations put on their matrix what are their material unwanted events in terms of health and safety, in terms of business impacts, in terms of environmental, in terms of social or reputational. Some have legal there. And the business can decide whether it's catastrophic or whether it's major, or what criteria they use to determine their material unwanted events. But mapping it to the matrix makes matrix consequence or impact category makes it very clear for people to understand what are the material unwanted events, particularly if they're familiar with using the matrix. Once you've determined what your material unwanted events are, then it's important that we actually scope what that event is. In developing the scope, we're making decisions about what's included and what's excluded in terms of the objective. So if the focus is just on the fatality type outcomes, then we might, for the scope of the work that we're going to do, ignore some of those other business outcomes. We would be also ignoring some of the lesser potential outcomes. We want to have a clear understanding what the hazards are, what the unwanted risk scenarios are. There can be a number of those risk scenarios associated with a material unwanted event. For example, a vehicle crash could have a vehicle to vehicle collision, could have a vehicle to object collision, could have a vehicle to pedestrian collision, could have a single vehicle rollover, and could have a vehicle over the edge type scenario. These are all captured in the scenario box. We want to understand the people that are involved in the management of risk or could be impacted by the risk. And this is people not only on site, but it may involve people off site. The locations where this risk needs to be managed, the equipment and plant associated with the management of the risk activities. Now, usually when we're doing risk-based analysis, we're really good as humans about thinking as business as usual type normal operations. But we also should be thinking about transient operations, the startups, the shutdowns, the abnormal tasks that can happen, timeframes. Are we running 24 hours a day, 7 days a week throughout the year, or are we doing stints every now and then, only on day shift, for example, or only during certain times of the year? External considerations are the extremes of weather, any flora and fauna issues, because they have been known to cause fatalities, and other external and society considerations such as security, cyber or physical security considerations. Doing the scope table provides a transparent document that people can query. It also can be linked to management of change. So when there is a change, you refer to your scope document to see if you need to update your risk assessment. Once we have our material unwanted event scoped, we can decide how we're going to, and we understand the scenarios, we can decide how we're going to treat it. The first thing that we should do is see if we can eliminate the hazards so we no longer have a material unwanted event, or substitute the hazard with something less hazardous. So again, we will no longer have a material unwanted event. We can also potentially eliminate or reduce human exposure to that hazard. And again, that impacts what we do with our controls. If we can't do the eliminate the hazard, substitute the hazard, or remove people from the hazard, then we might have to look at eliminating, or we should look at eliminating threats that could release the hazard, and implementing controls to either reduce the material unwanted event or mitigate it. And that's where, in this bottom two areas, where the ICMM process comes in. If you can deal with the risk with the top two, you don't need to worry about the ICMM process because it's no longer a material unwanted event. If you've got a material unwanted event, then you need to work out how to control it. And we do this by identifying the controls. As I previously said, when we've got a complex event that could cause a fatality, these types of tables are not helpful from a human user perspective. Leading practice uses the bow tie approach. So the bow tie is named a bow tie because of how it looks. It's a visualization of the unwanted event at the center of the bow tie, the causes, the things that can cause the unwanted event prior to any controls being in place on the left, the consequences on the right, and then we look to see what controls that we need to put in place to address each of the causes or threats so the unwanted event can't happen. We know, though, that none of our controls are absolutely perfect, so there are still scenarios where we might get the unwanted event. So we want to introduce controls that allow us to act if that unwanted event happens in order to mitigate the consequences so we don't get the fatalities. So the bow tie is very powerful because it's a visualization of our risks. It makes us check whether we've got enough controls to address each threat and enough controls to mitigate each consequence. Now, historically, that's as far as we've gone with the bow tie. But as I said right up front, one of the reasons why we keep having fatalities is these controls are not being implemented, not being monitored, and not being maintained or sustainably maintained over time. So we supplement the bow tie with an analysis to identify the supports and the management activities that each of those controls need to make sure that they're implemented, monitored, and maintained, and that they are effective at addressing the risk when they are required to be. And this management support activity, this control support and management system activities will cover operational activities, maintenance activities, engineering activities, and management activities. With the bow tie approach, there was no guidance put out on how to do quality bow ties, and you get a range of bow ties, many of which historically have not been legible. They're very hard to read, they're very hard to understand. That is not going to help us prevent fatalities. We need to be a little more succinct, a little more concise, produce user-friendly bow ties. So we developed a criteria for what is and isn't a control. And that's shown in the center of this slide. It's a control is something that of itself is a physical object, a human action, or a combination of both, which we've called a technological system. It is something that of itself must prevent or mitigate the unwanted event sequence, and its performance must be specifiable, measurable, and auditable. And if you're very disciplined in applying this criteria, you get concise and precise bow ties that actually fit on an A4 sheet of paper and tell you exactly what needs to be implemented and effective at preventing the unwanted event and mitigating it. So we've also extended the criteria because things like maintenance, procedures, permits, signage, none of those things of themselves directly prevent a fatality or mitigate a fatality. But we know they're still important. So where do they fit in the system? And this is where this diagram came up. So if it's not a control of itself, is it activity that maximizes the health or minimizes the erosion of the control? And is it activity that's specifiable, observable, and auditable? Now, activities like maintenance and training actually do help maximize the health or minimize the erosion of the control. Things like procedures do that too. Signage does that. So their supports is still very important. Things like permits and pre-start checks, they're not quite supports. They're more in-field checks to make sure the control is implemented, to make sure the control is will function as required, and to make sure the control is actually effective. And if it's those things, then they're verification activities. So they're still important in our system, but they're not controls. And this doing dividing the controls up this way creates really good understanding of what we need to check, what we need to support, and what is actually saving lives. And I run through an exercise when I'm teaching this, just to go through some of these things on the left, like competent driver, barricading off work areas, road speed sign, drug and alcohol testing, dust mask, site induction, those sorts of things. And I ask people, is it a control or a support or a verification or something different? So if you want to have a go and put your answers in the chat, you can do that. So is a competent driver a control? Is a barricade or a control, a support, a verification? Is a barricade a control, a support, or a verification? Is a road sign a control, support, or verification? It's a good exercise to do to make sure that we're all on the same page and all people in your organisation are on the same page about what is a control that we're going to put on our bow tie, that we're going to support, and that we're going to monitor through verification activities. As I said, once you be clear that of what is and what isn't a control, and in this case, the barricade is a control, the airbag is a control, and segregated roads is a control. The rest of themselves are not controls. A dust mask may be a control if it's worn correctly, but a mask of itself is not a control. It needs to be worn appropriately. The competent driver is a support. Barricading is a control. The speed sign is a support. The drug and alcohol testing, depending on how it's set up, could be a support or a verification. The site induction may be a support, but if it contains nothing about critical controls, then it's not even that. The pre-start check is a verification. The traffic management plan is a support. Positive comms is a support. Vehicle maintenance is a support. As I said, segregated roads control, and driver's license. It's hard to say whether it's a support or not even a part of the critical control. Depends on how it's set up, and it's set up differently across different jurisdictions. So as I said, once you get an understanding of what are your controls and what are your supports, then you get very concise and precise bow ties. But it's not enough to stop there. You still need to work out how you're going to implement the controls and the supports and monitor and maintain them so they're effective. Now, to make that practical and impactful, what we have done through the ICMM process is decided we know some controls are more important than others. So let's select those, call them critical controls, and make sure that we're doing really rigorous testing and checking of those. So what is a critical control? So here we have a lion who's a hazard. The top picture shows that there are a number of controls. There's PPE, there's a procedure, there's a gun, there's a communication system, and a barrier, a tent. Um, or the bottom one has a barrier, which is iron bars. Now, I don't need to ask, but I could probably guess that most of you would back your life on the iron bars over the anything in that top picture. And when it comes to our workplace risks that can kill people, there are often controls that are a bit the same, where people would back their life on those controls because the control is crucial at preventing the event or minimizing the fatality if the event occurs. It might be the only control you've got, but it's definitely a control where the absence of the control or its failure would significantly increase the risk. And sometimes, like in barricades, we see these and emergency response, we see these controls across multiple risks. So they're our critical controls. To put it in a decision tree format, critical controls, does the absence or failure of this control significantly increase the risk? And is the control commonly associated with previous incidents? It's going back to the fact that we need to learn from past events. And the near miss events tell us what controls are working. The fatality events can tell us what controls have failed. And would an additional level of verification, because in critical controls we have two levels of verification, one from the front line and one from senior management, would that help us ensure the control is performing as required? So once we've selected our critical controls, we need to define their performance. What we're doing here is we're saying what the objective of the control is so people understand why it's implemented and why it's important. And we describe what good performance looks like. So if we don't know what a good barricade looks like, then you'll have a variety of standards across a business. Where you have variety of standards, you often have a range from poor to good control. But if it's a critical control, it's required to prevent fatalities. We only want good controls. So we need to explain what good looks like so that those that are relying on the control can check the control to make sure it is good. They have criteria for what good looks like, and they have criteria for deviations. When deviations are sufficient enough in that control to stop the job or not start the job. So if it's pre-start, we need to not start the job. If we're doing something and we notice like a divot in a road that makes it unsafe, then we should stop the job. We need to put those stop-go triggers in SMART format. So it needs to be specific, measurable, achievable, realistic, and time-bound. So those that are relying on the control can check it and do actually know when to stop. Is the divot in the road, is it a 10 centimetre divot? Is it a 20 centimetre divot? Is half the wheel height divot? Does it have to be right across the road? They need to understand the control criteria which are required to stop a job or not start a job. And then they need to understand what to do about that criteria. Do they call the boss? Do they call an all stop? Do they evacuate to a safe space? What do they need to do that? Once the reporting is performance specification is determined, then we need to make sure that we have the accountabilities of the business clear so people know who's doing what. So the front line should know what the critical controls are. They should be able to check whether they're implemented and working and be authorized to action the stop-go rules. The front line checks The leaders, they're checking that the frontline checks are being done. They're independently checking the controls and making sure they're effective. And that independent check of the controls will improve the detection of controls that are not working. Their checking also of the frontline checks will improve the quality of the frontline checks. And that conversation that happens in that checker process helps also identify improvement opportunities for the controls. And then the senior leaders also do checks, but they also need to determine that the risks are being managed effectively, the controls are effective, and that people have the right competencies in place to do this work. So some of the questions that are asked by leaders are the frontline ensuring controls are implemented and working as required? When controls and when required and workers correctly responding to issues? It's an important check to see that workers know what the controls are, know that they're working, and be able to action them if they're not. We want frontline leaders to make sure that controls are also implemented across all risk exposures and are fully functional. When we find fatalities occurring, it's because those controls are not implemented across all risk exposures or they're not fully functional. We also can have leaders check whether the supports are actually working to make sure the controls are sustainable and healthy. So making sure that the maintenance is in place, making sure that training's in place, making sure the signage is in place. Leaders can do that or they can delegate that, but they need to make sure that it's happening. And they need to understand the effectiveness of the control at the end of the day. If it's only going to work to save 50% of the fatalities, then that's not truly a critical control and we need to improve its effectiveness. When you start doing these verifications, you start getting data back, but you can also use the bow ties and map that data onto the bow ties. And you can also use the bow ties to in incident investigations to work out what worked and what didn't work. This is an example of a vehicle, unsafe operation of a vehicle bow tie. And this is an analysis that was done on a large number of high potential or near miss incidents, where we can see that 3 controls are causing the unsafe movement of the vehicle and 2 controls are saving the fatalities. So, but you don't have to wait till incidents happen before you get this data. If you've got people in the field checking the controls, frontline and managers checking the controls, you can use their data to work out what is the failure rate or success rate of those controls. And that can produce really meaningful information. This data can also be done at a higher level. It's usually done on country data or international data on the fatalities. This is an example of the fatalities from vehicle accidents in the US mining industry. And again, whenever I do this analysis for organizations or for regulators or on big databases, you often see that there's a couple of controls that really are critical. And this one shows that 3 controls are causing or contributing 3 failures of these 3 controls are contributing to 60% of the fatalities in the US surface mining industry up to 2016. So it can be really powerful, create evidence-based information, and with, as I said, with the power of AI these days, you can have AI analyze your data to determine analyze historical incident reports to derive this sort of information. But you can also set up your systems to collect this information, your incident investigation systems to use the bow tie to collect the information, and your control checking systems to collect and collate the information back onto the bow ties. And you can start to, once you link your risk and hazard assessment, your event investigations, and your critical control checks, you can start to create pictures of or dashboards of how your risk is performing. If it's not performing, drill down and to find out which controls are failing or not performing as required. And then you can drill down into the supports that are causing the controls to fail. So is it because the training's not done? Is it because the maintenance is not done? Is it because the frontline or managerial checks are not done or the signs weren't in place? You can get really meaningful intelligence before you actually have events. And that's where the leading processes are currently pushing towards to prevent these fatalities. So we get proactive in understanding how our controls are performing and address them before we actually have an event. And then where we're trying to target or push to in leading practice is actually then provide that information back into the hands of the people in the field. So this is a picture of a crane lift in a refinery, petrochemical refinery. We can actually use AI interpretation of the picture and AI referencing of the historical data and the bow tie verification information to give that person meaningful information to help them check the controls and be aware of what the hazards are in that day. And that's where we have to get to, I think, is providing the information real time at the risk phase to inform the workers to help them stay safe. And that was my last slide. There's just some contact information, but the best way probably to contact me is either through the university or through LinkedIn. If you have any questions, I'm happy to take them now.
Thank you very much, Maureen. This was really insightful, very systematic, and I believe you narrowed it down to. There was consistent narrowing down of this, and the examples were very consistent. I think a great insight on our risk management, because personally, I could say we just do risk assessment. We hardly do risk management. And I think that can be picked much from the controls, where we end at the risk evaluation, and then the treatment is not seen as a critical element. And I think whoever was on this call may have picked good insights. So even considering that the 3100, the risk management ISO, has an extended version where you go much into the risk, the decisions of the risk treatment. And I think in this is where sometimes we have guides, but we don't go deep to understand that there's an extra we can understand. A great job, great insights, many lessons. I think one person picked one item that is up to now eye-catching. Maybe you'll allow me to mention it.
Okay.
Just in a second. Yep. So someone mentioned that we are not finding new ways of killing people. We both have we all know the causes and the risks. I think it was a citation from what you mentioned. And from this conversation, we can see that most people do risk assessment and they don't move beyond that point. And the other major aspect you indicated was how we monitor the controls, how we even assess the controls, where their effectiveness, and also looking at the stage of risk assessment, looking at the consequences or the rankings, and then we have to rethink backwards and now think about doing more evaluation of the controls, maybe dive into the critical control process or management. So sometimes a project comes in and people do a baseline risk assessment, but diving into the whole process of whether those controls will be effective is a great challenge to my fellow professionals here. So that was just a peek from the conversation we had with you. There are a number of questions I can see, not so many. And I think the first question that came in was about AI and risk management. You gave it, I think you gave it a shot. There are two questions which are related. One is asking how the AI can help in the in risk assessment specifically. And then the other one talked about the element of AI in identifying and managing risk. And then indicated that given that AI is a novel technology, the awareness of data protection protocols and how would you bridge that gap between protecting the organization's trade secrets and managing risks through such novel technology? So there are two questions, but one starts on how do we use AI? The other one has concern, and those came from Delik and Hassan. So I don't know if you can start with that. I know you've answered part of it, but maybe you can give it an extra to make sure the teams maybe.
Okay. So I'm just flicking through my slides. Let me just share. Where's my share? Back, hopefully. So in this slide, if you're doing templates like this, everyone's template's a little bit different in your risk assessment. You can populate these templates using the large language models by querying the large language models. It will give you, and we've done it before, once you've decided your scope, you can ask the large language models, what are my hazards, what are my risks, what are my unwanted events, and what are my controls? And can you give it to me in table form? And with a couple of iterations, you can get risk registers out of large language models. The problem with that is that 50% of the information that you get, at least 50%, is what we call hallucinations. It's made up, particularly around what the controls need to be. When you're using AI is referencing data sources that are typically 2 to 5 years, if not longer more, or if not older. So there's a lag in the information. You can, if you have access to coding abilities, you can point the AI engines to specific data sets, which is what the Australian Institute of Health and Safety has done if you want to look at their website. But still, the AI will look at that data, but it's trained on other data, so it will still make things up. So AI is a good way of creating drafts, can be a good way of creating drafts that are then critiqued, particularly around the controls. You need to critique what you're going to accept as a control and what you're not going to accept. You need to critique whether it's relevant for whether that control is relevant or going to be effective in your context. So it's a good way of getting rid of some of the tedious information, especially for common risks, but it does come with a few dangers. In the large language model arena, there are a range of different models. There is requirements now that the model, especially in certain jurisdictions, the models are very clear on that they have to declare what they're doing with your data, where they're sending your data, and what data they're referencing in analyzing your data. So in terms of privacy and company security, you can make determinations. You can select your large language model based on what sort of security you want. There are still I still personally would not be putting some commercially sensitive information in there. In risk, in fatality safety space, if you're doing the assessments using AI, you can do it generically and then get the outputs and then take it away from the AI engines and tailor it to your given context is probably the best way to go. That's for the risk assessment work. The AI has a lot of ability to monitor workers, amazing ability in profiling workers, in alerting workers, in helping workers be aware of their level of vigilance and what they're doing. There are significant privacy and potential commercial issues associated with that. So it's really important that if you're setting up an AI monitoring system, that you do get advice about how to do it in a way that is actually respectful of workers, because if workers don't trust it, it won't work, and it's respectful of the company's data. So I don't know whether that's answered the questions.
Yeah, that's a great insight, and I think one big pick is in the first place, it's you to determine the models, consider proper research into it. Then the other pick is use put in generic data that is not going to particularly point to your company. Don't put in sensitive information into the
No.
systems. And I think data protection is still a big issue, including even like the Teams calls, everything we're doing. There's a lot of privacy issues, but as long as you maintain the level of understanding that you're not providing sensitive information of the organization, then I believe you'll be already protecting it. So
Yeah.
where there is an actual model you've decided, you have your tech, your IT or computers team, which should be able to first do that assessment, run pilot studies before you roll on fully to it. So it's not about a dive in. It's not a one man's decision. It has to be a corporate decision when those models or those approaches are picked. It also has to be risk assessed itself. The model you're
Absolutely.
picking has to have a proper risk assessment.
It
And
does.
I think with that, as you've answered most of the worries and the approaches one would take to utilize AI to give to help in this fight for preventing incidents.
Yes.
Thank you once again. Those were the questions I could pick from here. Maybe if I would just pick something from what I look at. I believe there's a lot to learn. You've spoke of the mainly the bow tie model. It's so it's a very good approach for both proactive and post incident. But as you've mentioned, most of us treat it or use it when we are investigating major incidents. Yes, it's good. But now we've seen that you can use it to look at your critical controls. And maybe if at that area, I don't know, you've already spoke much about using that approach. But I believe that's a critical point. Even looking at your inputs where you're starting to sort your events that associated to your activities, still you can put in your bow tie to look at whether they similar. So I don't know, maybe if you have just a general oversight on that utilization of the bow tie in the different phases of risk management.
Yes. Yeah, so it is really good to use bow tie to proactively identify how you're going to manage a risk. You can then use the bow tie to feed back into your risk assessment spreadsheet, like to make sure that they're correlated. You can use the bow tie in incident, and you should use the bow tie in incident investigations. If you've had an investigation that relates to a bow tie, I say, and I have my students do it as well. Take the bow tie and then look at the incident and see what controls were present and what controls were absent. For the present controls, what controls were effective and what controls weren't effective. We've and we incidents are not good to have. I think we need to make sure that we maximize the learning when we have them in order to prevent them reoccurring. And the way to maximize that learning is to one way is to use that bow tie to really capture what we need to know about the what controls were contributed to the event, and what controls, if it's a near miss, we potentially had some controls that actually saved us too.
That's still another layer of understanding added onto that. And that means you're telling the team that we can also think of a session specifically for bow tie, not just for incident investigations, but for the proactive part of managing our workplaces and preventing fatalities. It's something
Yes.
noted. I believe the team in the shower team in the room can think about that, and maybe it's something we can look into as well. Yeah, we have two more questions I can see for now. And I think I'll first start with the first one. It appeared before. Someone is, this is one of our members is asking the clear distinction, to get a clear distinction between risk assessment and job hazard analysis, and how we can integrate them in preventing workplace injuries and fatalities. Went on to say that because we have scenarios where people only conduct job hazard analysis without conducting risk assessments, and they consider that enough. So maybe this is from Asaf, one of our members. You can maybe give.
Yeah, so a job hazard analysis is a risk assessment. Risk assessments can be done at various levels. So if you're doing a site-based risk assessment, it's usually called a hazard or a broad brush. If you're doing a job or task-based, and then it's a job-based risk assessment. The risk assessments, the detail changes between a job and a site-based risk assessment, but they should have commonalities. They should all identify what is the maximum consequence. And if that maximum consequence is a fatality or higher, then they should all refer to the same critical controls. So if you're doing a job hazard analysis and it involves working at heights, then it should refer to the working at heights critical controls. So they're linked. They're just at different levels of detail. The process should be the same. What are my hazards? What are the unwanted events that can emerge from those hazards? How significant, or what is the significance of the consequence of the unwanted events? If it's significant, what controls do I need to manage that event? Now, some organisations say if your job hazard analysis is detecting a fatality risk and you don't know what the critical control is, then you need to elevate that in the organisation to get help from either the safety or the managerial support that's available to you.
Yep, thank you. I think that's very clear. I think it's more, rather than differentiation, it's looking at the, as you've mentioned, it is looking at the maximum consequence, whichever way you go, whether you're doing job hazard analysis or risk assessment, you need to consider the maximum consequence, and then that's
Yes.
where the treatment gets you to the critical controls, or if you have them. And so I think even if, as you've mentioned, how you present the data may not be the main problem, but also looking at what we look at beyond just what we've presented there. If you want to output that into a bow tie or an extra, extended risk assessment is what may matter most. But the templates may look the same, may look different, but your intention is what are you assessing against? And I think you've really landed that we need to look at our maximum consequence and look at our critical controls, especially if your maximum consequence, for instance, results into a fatality. Whether it's a JHA or the other risk assessment, you need to still go back to the basics and look at that. There was another question, and basically this came in. This is Dennis asked, do you recommend a system that keeps the controls alive? At my workplace, we assign MUE to different trained champions to conduct quarterly verifications of critical control effectiveness. Actions generated in case of gaps are picked up. Yep. Is this a good approach?
Yes.
That's the question.
Yeah, they have to be alive. You have to understand in real time, or as close to real time, how they're performing. Otherwise, we can't rely on them. It's important that that information gets back to the people who are checking the control and relying on the control. That feedback loop is really important, because if you have got people checking the controls and then they're handing that information into the system somehow and they don't hear back, then what we have observed is that then that becomes more of we call it a tick and flick. Here in Australia, people are just doing the paperwork and putting it in the system thinking it doesn't matter because nobody's doing anything with it. So you've got to make sure that information there's a feedback loop for any information that you're collecting. So you're feeding back on what is the effectiveness of the critical controls and what actions have been generated and what improvements have been made, and celebrating that continuous improvement type activity.
I believe the person who asked this question, as you've mentioned, this is this is a good approach. And maybe the quick takeaways is making sure that the feedback loop is not a closed one. What comes out of those inputs or quarterly verifications goes back to the assessment part backwards. If it's good, it's a celebration. If it's not good, there are lessons and improvements. And I believe, as you mentioned, live, it has to be live. If it
Yeah. So
dies,
we
yes, yes,
celebrate not good. We
yeah,
celebrate not good when we pick up proactively that a control isn't performing, that a control is not good. We celebrate that because it gets, especially, somebody's picked it up, somebody's addressed it, that saves lives. We have critical controls that for some reason was not working. It got detected, it got fixed, lives are saved. So that some call that celebrating the red. We're celebrating problem controls. We're celebrating that we're getting them before we have the incidents. So I think that's an important part of the whole program too.
yeah. I think that's good. Then someone here also mentioned, okay, like risk assessment and job, GRA or JHA, one and the same. The difference is the scope and level. So I believe, well, that's another area maybe to discuss, as you mentioned. The problem is not the difference. The problem is the outputs, the outcome, and how deeply one is done. Yeah, I think you talked about this. I don't
Yep.
want to go back to it unless someone has an extra. That's clear. Joseph, if you could type the question in the chat, it would be much better because we would not easily have much time to do that. So I can see these are some of the questions. Good enough, the presentation and the discussion. There was more than the presentation that you presented here. There were clear examples beyond that. So I still believe great takeaways from this conversation, and maybe questions to ourselves as practitioners, as health and safety, and as researchers, is how much data do we have? I've seen you mentioning the input of, let's say, the incident data into the system, into the bow tie to analyze it, and basically that would also give us whether the controls are okay, whether the extra measures or critical controls are effective. And that goes into the big data, and it may still go to the AI, as you've mentioned. People can put in data as long as maybe you don't mention it is company A, or you do it on the side and then get your results, integrate them backwards to the system or the results. So still, it's at that level. I don't know if there's a new message. Someone asked about, yeah, this was another question about a management commitment. It's a question maybe I wanted to pose. The top management behaviors, yep, especially on the execution of controls. Here the person says the big setback in the country, that
Yep.
you will do your risk assessment, do the evaluations, and reach a point where you say these are our critical controls. And the management support seems to lag. And maybe this will be the question, how do we bring management on board? Which methods, which approaches can we use to make sure that after doing all this, should they be involved in the initial process? Should they see the controls along the way? So you can give us an approach that can maybe help us understand that.
So a couple of things. One thing that we do is we present to management so they understand the approach, because it's hard to support something that you don't understand. And this type of material is generally not taught through any of the leadership training that's given to different people, or even in undergraduate programs or university programs. So education is big for the leadership. And the other thing that we tend to do is we actually make them a risk owner. So if you've got a fatality risk or a multiple fatality risk, that risk needs to be owned by a senior manager who has to make sure that the critical controls, the bow tie's done, the critical controls are the right ones, the critical controls are being monitored, and that they are effective. We give them that accountability. So it's not uncommon for a site senior manager or even somebody higher up in the organisation to have the responsibility for a particular material unwanted event. And they have to report that on that event at a regular, and how it's being managed and controlled on a regular basis.
Okay. Yep. I believe you've picked that. That you picked clearly the involvement, and I believe that may be the first challenge. How do you get management on board? Because, as you've mentioned, if they are not involved, they may not understand this. Basically, I've got opportunities to do presentations where we have project kickoff meetings. And I'll say a big chance we usually have top management involved in. So don't miss out on presenting the key risks for that project and the key controls. And maybe along the team internally, they know that there are accountabilities. I believe from that point, you may have another meeting. You may have another meeting with them. They want to understand what is my responsibility. There are many ways, but as you've mentioned, if you involve them and make them accountable to critical control and basically accountable of making sure it is monitored, it is effective, they'll stay on board. And I believe most projects or activities, top management also believe in zero harm. Only that we tend not to keep it at the agenda table always, so that we remind them that it is the main objective to make sure that we don't have a fatality. People need to go back home. So there, as you've mentioned, it's so critical, and we can only do that by making them accountable. I'm not seeing any other question, and I don't know, based on the time we had planned, think we can still have this conversation till the end of the day, but since we had planned, someone was asking something here. I think I'll either pick this question and then you give maybe your last remarks considering this. The question is just about the difference between the hazard and the risk.
Yep.
And someone is asking if we can possibly eliminate a risk the same as we do to hazards from the workplace. That was Jonathan's question.
Yeah. So the hazard is the thing that can cause harm before you put any controls in place. Sometimes we mix hazards with failed controls. The risk is the assessment of that the likelihood and the likelihood of certain consequences coming from that hazard. So the risk is a likelihood and consequence assessment of the loss of control of a hazard. And what the second part of the question was, can we eliminate risks the same way we can eliminate hazards? That's a really good question. So if you can eliminate a likelihood, or you can eliminate the consequence of the release of a hazard, then um, you can, it is effectively eliminating the exposure to that hazard from the workplace.
Okay, that's all done. Now to kindly ask you and give back. Let's first have the president of Safety and Health Association of Uganda give the remarks, and maybe you'll do the parting shots, and then we close the conversation.
All right.
Sunday, you.
Thank you. Hope I'm audible, Norman. You can confirm that.
You're very audible.
Thank you. My apologies. I will not be able to come on Zoom. I'm kind of teetering from my phone. Good afternoon, good morning, good evening, depending on where you are joining us from. I would want to, on behalf of the Health and Safety Association of Uganda, my name is Sunday Achidri. I am the president for this association. On behalf of the Health and Safety Association of Uganda and organizing team, I wish to extend our deepest gratitude to Professor Maureen for delivering such an insightful and impactful webinar on leading approaches to preventing workplace fatalities. Within your 1 hour presentation, you have tackled quite a number of things. I didn't expect it, but I was just amazed. You tackled areas around how strong safety leadership and culture can shape workplace fatality prevention. You tackled risk-based thinking and hazard identification. You tackled competence development, the use of technology and data analysis, how the engineering controls and safe designs can prevent fatalities, how the robust OS management system and workplace engagement and participation can all help to shape and reduce the workplace fatalities. I like your deep thinking and approach around risk management. You called out and clearly separated how risk assessment and risk treatment should be given a thorough thought, that all fatalities and injuries have been investigated before. There's nothing new. We just need to put sustainable controls when treating these risks. We need to come up with better ways to identify and manage our risk controls. Critical risk management remains our primary tool to eliminate fatalities. You mentioned that we need to maintain clear focus on mitigating risks that could lead to fatalities. You tackled the hierarchy of risk control, how the leading practices using the bow tie analysis by identifying the potential causes and the potential outcomes. You went ahead and enlightened us on the controls, the supporting activities, and the verification activities in risk management. Your presentation has not only deepened our understanding of the critical elements in workplace safety, but it has also challenged us to rethink our strategies. It has challenged us to adopt proactive measures and also strengthen our safety culture. The clarity, the depth, and the practical relevance of your message will surely influence how we approach safety leadership and risk prevention in our various organizations. Thank you for sharing your time, for your expertise, and for the passion you have for saving lives and improving workplaces. We are truly honored to have learned from you today. Once again, thank you, Professor Maureen.
Thank you. Thank you for that speech, and thank you for the opportunity. It has been good, and I've enjoyed discussing the topic with you, and hopefully this is the beginning of ongoing conversations so we can all work together to make our workplaces safe and fatality free. And I see in the chat that there's a number of comments about sharing the slide.